Cancer isn't just one disease, it's thousands of diseases, and different cancers are treated in different ways. Some cancers you might want to deal with by trying to cut them out. Some cancers you're going to treat by blasting them with radiation. Some cancers you're going to want to treat with chemotherapy. Cancer treatment with surgery and radiation tends to be local. So you're treating disease at sort of one site. If the cancer has spread, you can't just treat the one site. It's already gotten away and you need to change what you're going to do. So if you were thinking going in that I'm going to be able to cut out this cancer or just treat it with local radiation, and the PET scan shows that it's spread to other areas of the body, it changes your treatment paradigm. It means that you're going to have to go with a systemic treatment like chemotherapy or immunotherapy or something different that sort of deals with cancer throughout the body rather than cancer in just one place. PET-CT is a combination of two different technologies. It's PET scanning, which is positron emission tomography, and it's also a CT scanner, which is computed tomography. So PET scanning is when we take radioactive materials that give off positrons. The positrons find an electron in the patient. You have antimatter and matter. They blow up and turn into energy that we can see with the scanner. One of the things that it's really helpful for is localizing where disease is. So when cancer patients come in and they need to get worked up for their cancer, figuring out where the disease is, whether it's spread, if it's spread, how far it's spread, how many places it might have gone, and the combination of the PET imaging, which looks for the sugar and actually finds those cancer cells, with the CT imaging, which can precisely localize the anatomy. And so what PET-CT does is it takes those two technologies and it puts them together. So it fuses them so you can use the anatomy and the physiology. You can look to see where sugar is going precisely in the body because you've got the combination of those two technologies. And it helps get rid of distractors because it's not just cancer cells that take up sugar. So there's lots of white blood cells, for instance, in the body. If you've got an infection, that can also take up sugar. And so being able to combine the sugar imaging with the imaging from the CT can help you sort out and make the scan more useful and more precise. So PET-CT itself is a specific area within nuclear medicine that uses drugs that give off positrons. So nuclear medicine, it's sort of a lesser known field in medicine, and essentially what we do is we use radioactive drugs for diagnosing and treating different diseases. And so we give patients the drugs. We will often inject them with what we call radiopharmaceuticals, and those drugs give off tiny amounts of radiation. And then we can watch where they go. So we use specialized cameras in nuclear medicine, like the PET-CT scanner that we purchased with the foundation, to detect that radiation and see where it goes and what it's doing in the body. We can also use those radioactive drugs to treat different conditions, usually cancer, but we also treat thyroid disease. We can use it to treat arthritis. So there's a variety of different things that we can do with the radioactive drugs that we produce and use in the department. The most common atom that we use in PET imaging these days is fluorine-18, and the most common drug that we use is fluorine-18 fluorodeoxyglucose. And you might recognize the glucose part of that name, and that's just sugar. So a lot of what we do is we image how the body uses sugar. And there's a variety of different things that use sugar. Your brain uses sugar, your muscles use sugar, but cancer cells love eating sugar. Lots and lots of different types of cancers use sugar to survive and grow inside the body. And so we can watch those cancer cells eat the sugar and figure out where they are and if they've spread. So here's the patient's brain. Brain uses a lot of glucose. It uses a lot of sugar, and so there's lots of activity there. Getting down into, you can see the patient's arms, you can see the patient's heart. This is actually the pumping chamber of the heart, the left ventricle. It uses a fair bit of sugar. Patient's lungs around the heart. This is the patient's liver, getting down into the abdomen. You can see their bladder down here because the sugar gets cleared through the kidneys. And for this particular patient, unfortunately, they have a mass in their abdomen that's using sugar. So this is what we're looking for when we're doing a PET scan to see is there something going on. So the patient has a metabolically active tumor. This doesn't belong there. And we're seeing a few things around here, but it's a little bit hard to figure out exactly where they are, what structures they're in, whether or not those might be good or bad. So we move on to the CT part of the PET CT. What's that? That's computed tomography. We've had that technology around for quite a while, and it uses X-rays to take 3D images of the body. It's really, really good at looking at anatomy and finding things that aren't where they belong. So this is a CT scan, same patient, and you can see again the different structures. So you can see the patient's brain, you can see what's going on up in their skull. You can see the heart again. So we saw the sugar image of the heart. This is the anatomic image of the heart, the lungs, patient's liver again, getting down into the abdomen. And here's that thing that we were looking at on the sugar imaging that doesn't really belong there. And so what does the PET CT camera actually do is it lets us put those images together. So we can combine the two technologies and get fused images that allow you to see the anatomy and the sugar at the same time. So this is the same patient, and you can see how everything gets put together. So the activity in the brain, you can see that sitting inside the patient's skull. Here's the heart. You can see sort of faintly in the background the actual anatomy of the heart, and you can see how the heart is using sugar. So this is actually the muscle of the heart, and this is the blood inside the left ventricle, the pumping chamber of the heart. So you can actually see the difference between the muscle and the blood. The liver, you can see the anatomy, and you can also see a little bit of the sugar that it's using. And for that unfortunate thing in the pelvis and the abdomen, you can see the lesion on the CT scan, and you can see that it matches up exactly with where the sugar is being used. And unfortunately, we can also see that some of those little funny gray spots that we saw in the patient's pelvis, they're actually spots of disease. So they're places where the cancer has actually spread to. So that's really, really important for the doctors to know when they're treating the patient, because you do things differently if the cancer is localized to one site than if it started to spread through the body. So now I wanted to show you the new scanner, what we actually managed to purchase with the cooperation of the provincial government and the generous donations from folks like yourselves contributing to the QEII Foundation. So we'll head out. So a patient would arrive at the hospital, they'd get themselves checked in, and they'd come to the waiting area of the PET suite. So we've got a number of chairs. We're a little bit down on capacity because of some restrictions that are in place because of COVID. So the patient would come and they'd wait here until the technologists are ready for them. They might bring a family member with them for support, and then they'd come on into the PET suite. So the first place that they're going to go is we're going to talk to them. So we're going to figure out a little bit about them, figure out why they're here, make sure that we're doing the right thing for the right person, talk to them about what they've eaten. Because a lot of the PET scans use sugar, we need to know what their blood glucose level is. If they've got really high blood glucose, it can actually make it harder to see some things. So we have a little chat with them, make sure everything's okay, and then we would move them on into one of the uptake rooms so that they can actually get the radioactive sugar. So this is one of our uptake rooms. The patient would come in here, they'd get set up with an IV. Our technologists would administer the radioactive sugar, and then we would have them here for about an hour to wait while the sugar gets taken up. So when we give the radioactive sugar, it takes time for the cancer cells to accumulate that, for them to actually eat that sugar so that we can see it. So we want the patient to sort of be relaxed in a quiet environment, eyes closed. They could have a nap if they wanted, and that gives a chance for that sugar to get taken up by the patient and by the cancer cells. So this is one of 3 rooms that we have, and they're all roughly the same. One's a bit bigger so that if we've got patients who need to be on a stretcher or in a wheelchair, that there's a little bit more space for them. So once they're done with their uptake period and they've had a chance for that sugar to get taken up, then we would bring them across the hall into the actual PET scanner itself. So this is it. This is the beautiful new PET scanner that we purchased with the QEII Foundation. So the patient would lie down on the scanning bed, usually with their head pointing into the scanner, and then this is what we've got. So remember that there's 2 parts to a PET CT scanner. There's the PET part and there's the CT part. So the CT is here at the front. So they would have the CT scan, and then the PET part is at the back. You might be able to see that sort of glassy looking thing in the back there. That's where the PET detectors are. And so the difference between the base model scanner that we could have purchased and what we were able to purchase because of the Foundation is that extra 10 centimeters of detector width. And that allows us to tailor the examinations, do the examinations faster, and basically customize the test for the patient's needs. So this is it's a really cool instrument. We can use it to plan radiotherapy. So if someone's going to be having treatment for a cancer, we actually have lasers on the walls here that can help them line up in exactly the same position that they would be in when they're getting their radiotherapy treatment. And with the scanner, the scans probably take about 10 minutes these days. On the scanner that we had before, it was roughly 25 minutes. We can usually do a scan in sort of 10 to 15 minutes with the modern scanner. The control room's back in the back there, and that's where the technologists run the scanner, so they make sure that it's getting all the images that it needs and that we've gotten all the data that we want. So a CT works because you've got an X-ray tube on one side of the ring and you've got a detector on the other side of the ring, and that whole structure moves. So in order to generate a CT scan, you have to actually rotate the whole assembly around the patient. And you do a whole bunch of complicated math, and you can generate a 3D image of what's going on inside the patient. With the PET scanner, it's actually fixed. So rather than having something that rotates around the picture, you've got banks of detectors that are arrayed in a ring around the patient, and they pick up that radiation that's given off when the positron meets with the electron and turns into energy. So the big difference between this scanner and the scanner that we had before is that instead of having 15 centimeters of those PET detectors, we've got 25 centimeters of those PET detectors. And that was the contribution that came from the Foundation. I'm going to take you into the reporting room. So this is where I'm usually sitting and working when I'm on a day in the PET suite. And so these are the types of images that are coming off the camera, and we can look at them on the workstation and sort of move through them and try and figure out what's going on with the patient. We can look at the metabolic imaging, we can look at the anatomy, and this is how we're trying to sort things out. So a typical day in PET, what would that look like? So first of all, you have to make the sugar. And so the folks at the cyclotron arrive pretty early in the morning. They set up the cyclotron for production. In order to make those radioactive atoms that get incorporated into our sugar, they have to fire a high energy beam of particles at a little target, and that produces our fluorine. That gets run through a chemical process to actually put it into the sugar. Then they have to make sure that it's safe. So they do quality control on it. They do a whole bunch of tests to make sure that it's okay and that it's good to inject into the patient. So that's going on starting probably around 5 in the morning. The folks in the PET suite, so the technologists who actually run the scans and take the pictures, they'll be in around 7:30 to turn on the scanner, make sure that it's running properly. They do some quality control checks on that. At some point, we get a phone call from downstairs in the cyclotron, and they say the quality control on the sugar passed. So now we're at a point where we can actually inject it in the patients. So we move the patients into the uptake rooms. They're ready and waiting to go. They get their injection of sugar. They will sit quietly for probably about just under an hour to let the cancer cells take up the sugar so that we can see it. And then they'll move into the scanner. The scans, as I say, take 10 to 15 minutes, and then they'll head on out, go about their business for the rest of the day, and the next patient comes on in. There's a nuclear medicine physician in the other room, and they're going to be looking at those scans, making sure that they're okay, that we didn't miss anything, that there weren't any technical artifacts. And we'll usually try and do same-day reporting. So patient comes in, has their scan, and there's a report finished and finalized on the system by the time they're at home having dinner. This is the second PET scanner that we've had here in Halifax, and we were able to upgrade it from the base model because of the generosity of the Foundation. The original PET scanner was put in through some generous contributions from the foundation as well. So it's sort of the second generation of giving that's sort of carrying the program forward. Last year, I think we did about 2,800 PET scans. That was with our former scanner. We'd typically run a day. We'd have 13 to 14 patients through the PET suite. As we sort of got the new scanner commissioned, we're figuring out our new processes and all that sort of stuff. We tried to keep the numbers the same. COVID happened, which changed the referral pattern a little bit. But now we're sort of ramping back up. Today, I think we did about 17 cases. That's sort of our target for now, and we're looking to move that up to around 20 or 21 cases a day. When you've got a scanner like this, you can trade off a bunch of stuff. So we're able to tailor the examinations to do exactly what we need for the patients. If you try and keep the quality of the images the same, you can reduce the amount of dose of radiation dose that you give to the patient. So all of our scans right now, we use radioactive sugar. So if there's a patient who's really young and they've got a lot of years ahead of them, you want to keep the radiation dose for those kids down as low as possible. So we can reduce the dose, but keep the length of the scan the same. Take the same kid, they're really upset. They don't like needles. They don't like being in a hospital environment. We can keep the radiation dose the same, and we can reduce the length of the scan. So for some patients, we could do a scan as fast as 80 seconds. A typical PET scan we do in about 15 minutes. On the old scanner, it's about 25 minutes. So we can dramatically reduce the amount of time and customize those examinations for the patients. And that's all because we've got the top of the line. We're having this conversation while the COVID pandemic is going on. When everything hit and everything shut down, a lot of things changed. One of the things that changed was commercial flights disappeared. So our friends and colleagues in Newfoundland, they're starting their own PET program. They have a scanner, but they can't make their own sugar locally. So they get that radioactive sugar flown in from Toronto every day when they want to scan patients. When COVID hit, the commercial flights from Toronto to Newfoundland stopped. We were still flying from Halifax to Newfoundland, and so we got a call for help. They said, is there anything you guys can do to help us out and get that radioactive sugar? The team pulled together, did a whole bunch of work, and 2 weeks after we got the call for help, we shipped our first radioactive sugar from Halifax to Newfoundland so that they could keep their PET program running. And we wouldn't have been able to do that without this scanner, because having the top of the line equipment meant that we could reduce the amount of sugar that we were using for our patients and keep the quality of the scan the same. One of the great things about having a top of the line scanner is the flexibility for the future. So lots of research is going on, different ways to image different things. It's an imaging tool. We can ask it to image all sorts of stuff. You can image the prostate with it. There's research going on to image the heart using different things. Right now, a lot of what we do is image sugar utilization and how much sugar cancers are taking up. But there's imaging agents that are good for imaging the brain. There's agents for all sorts of different cancers that are under development. So it can help understand where you are in the disease process and what treatments are most likely to help you. And so that's the real impact. And that's something that we can do with PET in ways that you can't do with any other imaging technology.